I'd like to invite Dr. Aishwariya J Babu for the paper presentation.
Good afternoon, all the panel committee members and all the doctors present here. Myself, Dr. Aishwariya J Babu from Amrita School of Ayurveda, from the Department of Kaya Chikitsa. I am here to present on the topic Abhyanga as Dinacharya for cirrhosis cutis as skin care in geriatric population, a review paper. First, moving on to the introduction. The word Abhyanga is derived from Anga Dhatu, which denotes motion, and Abhi Upasarga in it. Thus, it means motion in different direction. Abhyanga is the process of rubbing the body with oil. Snehana is told as the synonym of Abhyanga, which means that it is the process of annoying the body with oil, ghee, etc. It's one among the 24 Pravichara Sneha told by Acharya Charaka. According to Acharya Charaka, just like a kumbha on Mardana with Sneha becomes Drita and Klesha Saha, likewise Abhyanga will lead to Dritata and Sutak and will eliminate Vata. No damage from Abhyanga will occur to a body who practice Nitya Abhyanga, and it is very Tochya. Abhyanga Majare Nityam Sa Jarasrama Vadaha, Drishti Prasada Pushti Ayuhu Sapna Sutakta Pratikit. Abhyanga is one among the Dinacharya mentioned in Ayurveda. As Dinacharya is having the effect on the entire health of the individuals, it conserves the body energy and it averts the body from degeneration. Among the various benefits of Abhyanga, the most praised one is its effects in improving the health of the skin. Skin as an organ is constantly exposed to internal and external changes, and so protection of the skin should be done as a daily routine. Sesame oil is considered as a pioneer to all the thailas in the classics. According to Acharya Vatvada, Tila has the quality to penetrate deep into the tissues and to spread throughout the bodies and is capable of entering even into the minute pores of the body. Now moving on to the description of Tila. Tila, sesame was one among the first crops processed for oil, and Tila represents immortality. The pharmacological activities of Tila in the skin include anti-inflammatory activity, antioxidant action, antimicrobial activity, wound healing activity, UV light protection. Tila penetrates into the minute srotas of Romakuba due to its Sukshma and Sara properties, and due to the Madhura Rasa predominance and karma such as Dibana and Dasayana, and its Tochya, and it nourishes the Tok Dhatu. It helps to eliminate the excess Vada in the Tok due to Vadahara properties. The Snigdha Guna helps to remove the wrinkles and also helps to bring hydration to the skin. The movement of the hairs and the temperature created helps to increase the penetration power of the skin. Now moving on to the condition called cirrhosis cutis. Cirrhosis cutis is one of the common clinical conditions in old age population, and cirrhosis cutis is associated with impairment in the natural barrier function and lack of moisturizing factors in the skin, leading to decreased skin hydration commonly seen in elderly population. The ICD-10 lists cirrhosis cutis L85.3 as a distinct diagnosis, and the epidemiological study shows that approximately 60% of the older adults have cirrhosis cutis. The skin deficient in hydrolipids is evident characteristic of cirrhosis, which is due to Vata Vritti. The clinical features of cirrhosis includes atopic dermatitis, in which the skin dries out in small patches, fine scales often involving the scalp as well as the body, larger, thicker scales as in Ichthyosis vulgaris, and eczema craculae, an extreme variant of osteoarthritis that resembles a dried out film of mud with erythematous skin between the patches and dry unruly hairs. Cirrhosis cutis, if ignored, can lead to insidious onset of cutaneous infections and chronic ulcers in all people. Currently, moisturizers are widely used in various dermatologic and cosmetic skin therapies. Although generally efficacious, the moisturizers can cause a number of unwanted side effects, including occlusive folliculitis, irritation, allergic contact dermatitis, and contact urticaria. Presently, there are no standard measures for managing the condition in conventional therapy. Moving to the materials and methods, Brihathrais and Lekuthrais were reviewed to analyze the various aspects of Abhyanga, Tila, Dinacharya, and Jara, and different databases are reviewed, and filters like clinical trials within 5 years and free full text were applied. And from that, the description of the relevant papers are given below. These are the description about some of the most relevant papers about this condition, and from this we can see that it's one of the common problem in the elderly people, and the current diagnosis and treatment of the cirrhosis cutis are also obtained from these papers, and the prevalence of cirrhosis in this current population of this geriatric people are also obtained from these relevant papers. Now moving on to the discussion. In Ayurveda, the Dhatu Kshaya induced by Vata in Vrittavastha is evident. The formed Rasadhatu is incapable to nourish the Dhadus in a Vritta. This results in the deterioration in the dermal health, and Tokka the Vata Lakshanas like roughness, dryness, and cracking, etc. hence become visible in elderly. Daily Abhyanga with Tila Taila will aid in Vata Shamana in the throat and helps to give Dhartida to the skin. According to Susruta, Abhyanga bestows smoothness to the skin and helps to alleviate the Kupita, Kapha, and Vata. It also nourishes the Dhadus and improves the complexion. And the Jaravastha is Vata Pradhana stage in the whole lifespan. And the Tilataila, due to its Vadahara property, it helps to eliminate the excess Vata in the throat and thereby reduces the dryness and roughness of the skin. And the Snigdha Guna of the oil helps to remove the wrinkles and helps to bring the hydration to the skin. And the Vrana Ropana and Twachya properties of the oil keep the skin healthy and maintains its barrier function. The Pradiloma movement of the hairs in the body during massage will aid in increasing the penetration power of the skin, and the effect of massage also helps in pushing the oil into the ducts of the skin appendages. Acharya Vagbhada has correlated this as Sneha entering in the srotas of Romakuba during the Abhyanga, and the oil which has penetrated into the stratum corneum layer can pass on to further layers of the skin without any difficulty. And from this table, the effect of the Abhyanga on different dhadus is based on the duration of how long the Abhyanga should be performed as a part of daily routine to maintain the healthy life. This is based on the description by Acharya Delhana. He explains the duration of Abhyanga. Hence, there is also a description of time duration of penetration of Sneha at various levels. As a daily routine, 10 minutes is sufficient, but for a disease condition, 30 to 60 minutes of Abhyanga is needed. Massage in specific direction improves blood circulation, facilitates removal of toxins from the tissues, relieves physical and mental fatigue, improves the functioning of the musculoskeletal system, clears stiffness and heaviness of the body, and it helps to provide feeling of lightness to the body. Now moving on to the conclusion. Skin is an organ with multiple functions in our body. It's a barrier that prevents us from both external injury and other microbial infections. And it's very important to protect the skin daily, especially in elderly population. Abhyanga is one among the Dinacharya mentioned in Ayurveda, which has specific effects on the Tuk Dhatu. And Abhyanga adds Shobha to the skin, removes wrinkles, and also adds Dhartida to the skin. And aging is an inevitable part of one's life, and the disorders related to it also come with time. In Ayurveda, it's clearly mentioned that Abhyanga alleviates Vata dosha and provides strength both physically and mentally. And since Abhyanga with Tilataila is Tochya, it could provide a significant impact on cirrhosis cutis in geriatric population, hence to protect the elderly skin from further damage. And these are the references. Thank you.
I invite Dr. Veena Vasudevan.
Thank you, Dr. Aishwariya. Next, I invite Dr. Veena Vasudevan for the paper presentation on the topic Understanding AVARANAJANYA MADHUMEHA. Dr. Veena?
Is able to hear?
Yes, Doctor. Doctor, please reduce the volume of another device from your place.
Good evening to one and all the. Can I start?
Sure, Doctor. Okay, please start, Doctor.
Understanding AVARANAJANYA MADHUMEHA. Welcome to the presentation of today's presentation. These are my contents: Prameha and Madhumeha, Avarana and Madhumeha, Ojas and Avaranajanya Madhumeha, adipose tissue and insulin resistance with special reference to Avaranajanya Madhumeha, Chikitsa and Ahara Vihara Kalpanams. Prameha is Andarpanottajanya Vyadhi, and also it is Tridosha Kobanimita, and it is of 20, Vimshati Stat. And Madhumeha is one among the Prameha, and it is Madhumehi Madhusama. Kashaya Madhura Panduruksham, Mehadiyo Naraha, Vata Koba Tasadintam, Pradyan Madhumeha. Madhumeha, one among the 4 types of Vadika Prameham, and it has the synonyms Shaudra Meha and also as Ojo Meha. Madhumeha can happen in 2 ways, either due to the Dadukshaya or due to Avarana. By consuming Kashaya, Kadutikta, Ruksha, Shida, and Vyayama, Abhyayama, Vega Santharana can cause doshan of dosha and dadu, results in Vadaja Prameham, and also the Nidanas like Swadu, Amla, Lavana, Guru, Sniktha, and Navadhanya, Anupamamsam causes Kabagobam, vitiates the Medo Dadu, results in Sthana Samstra and Vasti, associated with increase of Kleda, Speda, Resa, and Mamsa, results in Kavaja Prameham, and further degradation of the Saumya Dadu results in Kavadosha and causes the Vada, the Pitta and Rekta starts to expel and results in Pittaja Prameha. Further chronicity causes the depletion of the Dadu, eventually leads to the Vadaja Prameha. And the Avaranajanya Madhumeha can happen in other, as per the Charaga Sutra Sthanam Kendi Shirsiyam Adhyaya, it says that Avarana Vada can be aggravated either due to Datukshaya or Margasya Avarana. And in Kendriya Shirsiyam Adhyam, it says that Guru, Snikta, Amla, Lavana Aharas, Navan, Annapanam, Nidra, Asi Sukam, Akurvya Samshodhanam causes the Adipravartana of Shleshma and Pitta and Cha, Mayadashcha, Mamsa, and obstructs the Gadi of the Vada and leads to the Avarada Vada, and this provoked Vada takes the Ojas and brings to Vasti, causes the Madhumeha. As we know, Ojas, the Sarvadadu Saram, and also it has a mean stage, 2 stages of Vikriti, Oja Vishramsam and Oja Vyabhat. In case of Madhumeha, it happens chronologically, and Sushruta Acharya mentioned that Lakshanas like Sandhi Vislesho Gatrana, and also in further chronicity, the Sabda Guru Gatra, the Vada Shofam, Varna Bedam, Plani, Tantra can happen in this case. According to Chakramani commentary of Charaga Samhita Sutrasthana 30th chapter, Acharyas mention as in case of Madhumeha, Apara Ojas is affected and not the para ojas. Apara ojas is Sarva Sharira Vyabhi. Even the slight variation of this para ojas leads to death, and in Madhumeha, even the Apara Ojakshaya happens and person still survives. In Charaga Nidana also, Acharya quoted as Oja Purar Madhura Swabhavam Tat Yada Raushad Vayu Kashayatven Abhisamsrujya Mutrashya Abhivahati Tada Medo Mekam Karodi. When Vada it brings the ojas which is in Madhura Rasa and having its Api Guna and further makes into Kashaya Rasa by the Ruksha of Guna of Vada. And once the ojas becomes Kashaya Rasa, it increases the Rukshatva in Mutrashyam, and this results in increase of Vada, and this brings the ojas into Mutrashyam and makes into Kashaya Rasa, and this further leads to Madhumeha. And also in modern view, there is a concept of adipose tissue and insulin resistance, and this can be make a special reference to Avaranajanya Madhumeha, as adipose tissue metabolism experts and impact on whole body metabolism, and also the brown white tissue of adipocytes are responsible for the hormone synthesis and also for the biological functions. Adipogenesis mechanism is of main types. They are lipogenesis and lipolysis. Lipogenesis is responsible for the synthesis of fatty acid, where the other one is the oxidation of the fatty acid. In case of obesity, adipose tissue is in a state of systemic chronic low-grade inflammation, and the cells fails to respond to insulin hormone, and this adiponectin level are reduced, and this contributes to insulin resistance. And the fat cell, in case of insulin resistance, reduce the glucose uptake also. And this results in the reduced muscle glucose intake, and it releases the free fatty acid to the blood. And this increases the liver glucose production and further results in high blood glucose level. If more insulin is not secreted, it causes the resistivity, and this finally results in the type 2 diabetes mellitus. And the condition of the insulin resistance can be compared to a Sangha type of Srodha Doshti, and this may be due to the Avarana. Mechanism of type 2 diabetes mellitus due to the fat per butte can be easily compared with disturbance in metabolism. And the concept of AVARANAJANYA MADHUMEHA matches with the modern findings of the insulin resistance, and in type 2 diabetes it is happening. And the Vada Gadi is obstructed, and the Medho Dhadu Agni is due to Avarana is evident also. Moving on to the aspect of Chikitsa, Dravyabodha Chikitsa and Adravyabodha Chikitsa. The treatment modalities should be focused on Avarnahara Chikitsa followed by the Pramehara Chikitsa, as this is a Pradhana Vyadhi. That is Thula Pramehi Balavani Hen, Prishasthaga, Paratopalashya, Sabramanam, Prishasya Guidam, Samshodanam, Dosha Veladivasi. The other portion of followed with Vadashama treatment modalities should be adopted, as there is Uttara Dhatu involvement here. There will be Shoshana of Samya Dhatu causes the Vadako. And the treatment principle also included the Avaranahara Chikitsa followed by the Pramehara Chikitsa, that is Srodho Shuddhikaraga, Kapapita, Aviruddha, Adhanilomana. The patient is Bala, Mridu Hamsana, Rasayana, Abhyanga Rasayana, and all can be adopted. And also this Avaranahara Chikitsa, Abhyanga Rasayana, and also this Shilajatu plays a crucial role. And according to Ashtanga Vidya Uttarasthana, 40th chapter, Gugula Prayoga is mentioned Medho Vikara and Avarana Chikitsa. It does the Srodho Shodhana, and it is also act as a Naimitika Rasayana. And also this Shiladaju Rasayana is indicated in Meha, as it has having Kashahanu Rasayana. And also this Chandra Prabhadi is also a crucial role. And in the Adravibhuti Chikitsa is also plays Achadana, Munivartana. And also this Ahara Vihara Kalpanas have a crucial role because it is a effect of a sedentary lifestyle also. It has a great, this Ayurveda has a great emphasis on this condition. As this condition is a Sandharpanottajanya Vyadhi, and Dhatu Agni Madhya is here, spices with the Kadu Ushna Aharas and Kadu Vibhaga can be adopted, as it is having Amapajana, and also Amlaki will be a best option. Yogasanas have also a great emphasis on this pancreatic and insulin production. Moving on to the conclusion, Ayurveda concept of Avarana is exactly matching with this type 2 diabetes mellitus, and fat globule acts as an endocrine gland, and it has a major role, brings about the insulin resistance. And also this concept of Avaranajanya Madhumeham is a unique concept told by the Acharya Charaka in Kendra Shirasya Madhyam Sutrasthan Sanin chapter, and this condition should be managed, followed by the Avaranahara Chikitsa with Pramehara Chikitsa, and should focus on the Dhatu Poshana, as there is Uttara Dhatu involvement and Saumya Dhatu Shoshana happens. Thank you.
Thank you, Dr. Veena. Next, I invite Dr. Deepthikrishna for the paper presentation on the topic an Ayurvedic treatment protocol to manage primary hyperhidrosis-A pilot study. Dr. Deepthikrishna. Hello, Dr. Deepthikrishna, are you there?
Yes, sir.
Okay.
Am I audible?
Audible, doctor.
Hello?
Hello, you are audible, doctor.
Hello, sir? Yeah, okay. Is my screen visible?
It is in sharing, doctor. Not visible, it is in sharing. Okay, doctor, now visible, doctor. Please start, doctor.
Okay. Respected panel members and all the doctors who are gathered here, good evening to all. Myself, Dr. Deepthikrishna Ji, second year PG scholar from the Department of Kayajigulsa, Amrita School of Ayurveda. Today, the title of my presentation is Hyperhidrosis-A. Moving on to introduction. Primary focus primary hyperhidrosis meant international classification of disease ICD-10, 1074, 590, under the of and appendages. It is a pathological disorders and characteristic by sweating in the palmar surface of the hands, axilla, soles, face. As the etiology is unknown, it is not posed the root cause. This affects both men and women equally in the age group between 18 to 39 years. So the primary hyperhidrosis is potentially underdiagnosed and undertreated. The complication of hyperhidrosis include the infection and social and emotional effects. The infections means this sweating, profuse sweating causes the skin infections, and in social and emotional effects like clamming or dripping of hands and perspiration of clothes, which affect the work and activities of the affected person, associated with considerable physical, psychosocial, and occupational impairments, will negatively affect the quality of life of the patient. Next, moving on to the present standard of care and its limitations. A number of systemic, topical, surgical, and electrical remedies are available, but it's having their own side effects. Patient with axillary hyperhidrosis will be given with strong antiperspirants. If it is not improving by that, botulinum toxin type A injection will be given. And non-surgical treatment complications will be transient, and the surgical treatment complication will be mostly permanent and significant. And the complications to surgical interventions are Horner syndrome, brachial injuries, pneumothorax, compensatory hyperhidrosis, usually involving the trunk and the lower limbs, respiratory sweating, phantom sweating, neuralgia, etc. And non-surgical treatments causes long-term to short-term problems like skin irritation, discoloration of skin, destroying of sweat glands, reversible muscle weakness, hyperpigmentation, paresthesia, etc. In severe cases, surgical interventions like sweat glands and sympathectomies, etc. are used. Next, moving on of this condition. Primary hyperhidrosis affects approximately 3% of the population in USA, at least 176 million people worldwide. The prevalence is likely significantly higher than the estimate because it is both reported by the patient and underdiagnosed by the physicians. Especially in developing countries like India, general population are seldom aware of this condition and seek medical attention. Studies on this topic from India are very rare. A study carried out in a healthy individual in India revealed that overall 38% of the students were suffering from somewhat bothersome to extremely bothersome hyperhidrosis. Almost 30% of students required appropriate treatment and care. Next, moving on to the Ayurvedic understanding of this condition. The primary hyperhidrosis can be correlated with Adhisveda. The clinical features of this condition is similar to Adhisveda, which is one among the 14 types of Pittajan Anadmaja Vigara. The Dravaguna Vritti of Pitta contribute to the Kleda Vritti that should be achieved. Abhyanga action as an affinity and also as an affinity towards work, followed by application of Shidishadi Churna in the form of dust powder, which is explained in the Charaka Samhita Sutrasana Arabhadi Adhyayam, which having the Svedahara and Daurgandhihara has been chosen for this condition. Next, moving on to methodology. The study design is pilot study with pre and post test study design. The sample size are 5 patients within the age group of 18 to 40 years.
Hello, doctor. Hello, Dr. Deepthikrishna. Now screen is visible, Dr. Veena. Dr. Deepthikrishna, please unmute, doctor.
Hello.
Hello. Yes, doctor. Audible, doctor.
Okay. Next, moving on to the methodology. The study design, pilot study with pre and post test study design. Sample size 5 patients within the age group of 18 to 40 years who fulfill the diagnostic criteria with moderate to intolerable severity. That means hyperhidrosis disease severity scale score within the score limit of 2 to 4. And the objective is to assess the change in HDSS hydroQOL score, hyperhidrosis quality of life index score, and to assess the change in transepidermal water loss and hydration levels using Dermalab combo system. The Dermalab combo system is a comprehensive skin analysis developed by the Cortex technology. It is mainly used to the researches related to skin. And assessment change in the HDSS score, hydroQOL score, and change in the transepidermal water loss, hydration levels you assessed by using Dermalab combo system will be done. And the diagnostic criteria by International Hyperhidrosis Society are the localized excessive sweating of at least 6 months duration with unknown cause with minimum of 2 of the following traits. That is bilateral relatively symmetrical sweating, sweating that impairs daily activity, occurs at least once in a week, age of onset less than 25 years, positive family history of hyperhidrosis, and cessation of focal sweating during sleep. If the patient having any of the two of the following types will be taken for the study. Next, moving on to the inclusion and exclusion criteria. The diagnosed case of primary hyperhidrosis who fulfill the diagnostic criteria and HDSS score grading to 2 to 4 of both sexes belong the age group of between 80 to 40 years will be taken. And the exclusion criteria are secondary hyperhidrosis, patient taking medicine for psychiatric disorders, pregnant woman, lactating woman, and patient underwent prior surgical procedure, prior treatment with anti-hyperhidrosis medical device, or use of other treatment with anticholinergic activity. Next is the therapeutic interventions. From the 1st to 7th day, for the Rukshana purpose, Padola Gadironia Kashayam will be given 50 ml twice daily before food will be given. And from the 8th to 35th day, for 4 weeks, for the purpose of Shamana, external application in the form of dusting powder, that is Shirishadi Churnam, will be given for 4 weeks. And next, moving on to the outcome. This both table before and after treatment course result of mean value of transepidermal water loss, hydration, HDSS, and hydroQOL values of 5 patients who are affected with primary focal hyperhidrosis. And from this, we can elicit a marked relief in the mean score value of these two, and before and after the treatment. And from this, we can clear that the TEWL value is reduced and the hydration values increase, whereas the transepidermal water loss and hydration values inversely proportional to each other. Next, moving on to the discussion. The primary focal hyperhidrosis is a pathological disorders. In Ayurveda, it is not, which affects the focal sites. And in Ayurveda, no studies has been done till now in this particular area. The current standard of care have their own limitation and still keeping a large group of adult population under the physical and emotional burden of hyperhidrosis. Hence, we have to take up this study to explore the potential of Ayurveda management in this condition. Thus, by analyzing the objective parameters like TEWL, hydration, before and after the treatment course, we can elicit a significant reduction in the TEWL value by maintaining the natural moisturizing factor, that is hydration of the skin. And moreover, by analyzing the subjective parameters like hyperhidrosis disease severity scale score and hydroQOL, revealed a notable change in sweating over the focal sites. Next, moving on to the conclusion. A course of 35 days of treatment includes Kledakara due to Dravaguna Vritti of Pitta can be achieved by the internal administration of Padola Kadironia Kashayam for 7 days, and the external application of Shirishadi Churna in the form of dusting powder is effective in improving HDSS, hydroQOL, TEWL, and hydration levels. By this, I am concluding my topic. Thank you.
Thank you, Dr. Deepthikrishna. Next, I invite Dr. Priyasingh for the paper presentation on the topic Role of Dinacharya for Healthy Life. Dr. Priyasingh. Hello, Dr. Priyasingh.
Hello, sir.
Okay, Doctor, please share the screen, Doctor.
Yes, sir, sure.
Your screen is visible, doctor. Your screen is visible, doctor. Please start, doctor.
Okay. Thank you. Good evening, everybody. Today, myself, Dr. Priyasingh. I'm here to present my topic of Dinacharya, a key to maintain healthy lifestyle. I'm Dr. Priyasingh, second year PG scholar, Department of Ayurvedic, Dr. NRS Government Ayurvedic College, Vijayawada. So, the introduction is Ayurveda is an ancient science of life. It is a science which not only deals with the curative aspect of disease, but gives more important to preventive aspect, like prevention is better than cure. So, there is a close relationship between lifestyle of an individual and the state of health and the disease. Lifestyle refers to someone's way of living, or we can say the dietary and ahar and vihar choices of an individual that he and she usually practice in the daily routine of life. So the science of Ayurveda has two main objectives: Swasthasya Swasthya Rakshanam and Aturasya Vikar Prashanam Cha, that is to maintain the positive health in the individuals who are healthy, and the second one is to treat the persons who are suffering from disease. So for fulfillment of the first objective, that is to maintain positive health in and healthy individuals, Ayurveda has mentioned some lifestyle strategies. First is Dinacharya, second Ritucharya, third is Sattvic, and fourth is Ashtanga Yoga. All these strategies are preventive rather than curative, and Dinacharya is one of these preventive principles of Ayurveda. These daily regimens, if followed regularly, have beneficial physiological effects on our body and our mind. So Ayurveda describes some daily regimen modalities for maintenance of positive health required for achievement of a long, healthy, active life, achieving satisfactory enjoyment of life and attainment of self-realization. So, in Dinacharya, there are different steps to follow. First is Brahma Muhurt or pre-dawn, we can say. It is advisable to wake up during Brahma Muhurt, that is early in the morning, that is 90 minutes before sunrise. Brahma is a knowledge which is gained by reading. The time which is ideal for the gain of knowledge is Brahma Muhurta. So what is happening in Brahma Muhurta is nascent oxygen in the atmosphere in the early morning easily and readily mixes up with the hemoglobin to form oxyhemoglobin, which nourishes the remote tissues rapidly. Exposure to bright light in early morning causes the release of serotonin, which is happy hormone, which contributes to feelings of well-being and happiness and keeps a person active and alert. So today's modern lifestyle results into development of many faulty habits like late night sleeping and waking up in the morning. Late night sleeping can cause elevation of cortisol, which is stress hormone, leading to the elevation of blood pressure, obesity, and diabetes, which is like lifestyle disorders. Another one is Soch Vidhi. Every person should eliminate the natural urges, feces, and urine daily. Faces north in the morning hours and south in the night. Defecation at proper time clears the rectum, increases digestive power, and prevents various manifestations like constipation, false smelling platters. Suppression of natural urges leads to vitiation of vata, which can cause number of diseases. Third is Dant Dhawan. One should brush with the twigs of Arka, Nyogradha, Khadir, Karanj, and Arjuna. The twigs length should be 12th inch and thickness must be ounce little finger. Katu in like Katu, Tikth, and Kashai and Madhu, these rasas are prescribed. In Katu they said Karanj, in Tikth they said Nimba, and Kashai they said Khadir, and Madhu they said Madhuk. These tablets are useful in brushing. If no twigs is available, then we can use Trifla, powders of Trifla, Trikatu, Trijatak. It is directed to clean the teeth in the morning and after taking meals. It stimulates taste perception and increases the salivation. Saliva contains salivary amylase enzyme, which plays a role in the breaking down food particles entrapped within dental crevices, thus protecting teeth from the bacterial decay. Saliva contains lysozyme and secretory IgA, which act as an antimicrobial agents, which helps in maintaining the healthy teeth. In Ayurvedic text, it is mentioned to clean the teeth by chewing ticks of certain medicinal plants, which makes the gum stronger and is also a good exercise of facial muscle. There is some contraindication in which we can't use Ajeen, Vamthur, Shwas, Kas, Jwar, Ardit, Trishna, Asyapak, Hridaya, Rog, Netra, Shiro, and Karna Rogas. Another one is Jiva Nirlekhan, that is tongue scraping. Tongue should be cleaned by an instrument which is smooth, soft, 10 angul in length, made of silver, gold, or iron. It removes the dirt of tongue, bad taste, and foul smell of tongue, mouth, and teeth. Produces better taste, cleanliness, and softness of the mouth. According to acupressure theory, tongue has many more acupressure points which initiate the proper function of vital organs like liver, kidney, bladder, stomach, and intestine. Another one is Anjana, that is collyrium. Daily use of Sovir Anjana, that is antimony sulfide, as collyrium is excellent for protecting eyes. In today's time, excessive work on computer results in dry eye or computer vision syndrome. When Anjana dravyas are applied, it causes irritation to the eyelids and conjunctiva and enhances the circulation. Therefore, Rasanjana prepared from Berberis aristata is to be applied once in a week to elevate the vitiated curve for keeping the vision clear. The gold ornaments, they gave some example to explain this theory, like why we should apply the Anjana. The gold ornaments are cleaned by means of cloth and hairbrush. Similarly, application of collyrium means the eyes make them shine like bright moon in the clear sky. Another one is Nasyan medicine. What is Nasyan? Medicine is administered through nostril, is known as Nasya. Sticky nature of the Nasya dravyas avoids the entry of dust particles into the nasal tract. The olfactory nerve endings are seen on cribriform plate of ethmoid bone. Nasya dravya triggers the nerve endings and sends a message to the CNS and initiates the normal physiological functions of the body. It prevents the disease of eye, nose, and ear, keep the shoulder, neck, and chest strong. Voice becomes sweet, mouth becomes fresh and free from foul smell. All sense organs become clear and strength, no grey hair and no hair fall. Another is Dhumpan. In daily regimen, Dhumpan is indicated following times for vitiated cough and Vata doshas. One should practice Dhumpan after Snan, Bhojanam, Dantadhavan, Jiva Nirlekhan, Shavtu, Nasya, Anjan, Nitra. There are 8 kals for Dhumpan. So it's the benefits of Dhumpan is it strengthens hair, skull, bones, sense organs, and voice. Disinfectant action of the Dhumpan dravyas like Haridra, Gugulu, and Vacha cleanse the respiratory tract, oral cavity, and pharynx. Adverse effect of smoking, improper or excess leading in Raktapit, giddiness, blindness, numbness, and dumbness. Another is Gandush. The Sukhasana, Gandush, and Kaval dravyas are used, which improves the circulation of oral cavity. Gargling procedure of Kaval causes the massaging effect over the oral mucosa and even strengthens the muscles of cheek, face, and jaw bones. It enhances strength of mandible, resonance of voice, nourishment of face, taste and sensation, and gives good taste. It prevents dryness of throat, cracking of lips, decay of tooth, and makes teeth strong. Another one is Tambul Sevan. It stimulates the taste bud, increases salivation, scraps the deposited matter. It keeps the mouth fresh, tasty, and good smell. Abhyanga. A person should do oil massage daily. Massage enhances the overall blood circulation and transfer the potency of drugs to the desired part. Massage triggers the acupressure point, which induces the release of endorphins, which shows analgesic effect. It delays aging, relieves fatigue, and mitigates vata. Promotes strength, increase lifespan, and relieves insomnia. Restores toughness as well as prettiness to the skin, and body becomes strong. Oil should be specially to the head, ear, and foot along with the whole body. It relieves headache, baldness, graying, and falling of hair, promotes sleep and vision, relieves cracks on the soles. Vyayam. Activities which produce tiredness to the body is known as Vyayam. Physical exercise increases the carbohydrate metabolism, that is glycolysis, and causes lipolysis of accumulated adipose tissue, thereby causing abolishment of extra fat. It increases oxygen supply to remote tissues. The perspiration takes out the accumulated toxins from the body. Body becomes light, able to perform normal duties with enthusiasm, increases the power of digestion, reduces the fat, and body parts become distinct in form. Another one is Snan. Daily bath improves enthusiasm, strength, appetite, and removes sweat and other impurities from the body. Taking bath is auspicious, increases vitality, longevity, strength, compactness, and ojas at the same time. Causes tiredness, sweat, and impurities of the body. Bath takes away sleep, burning sensation, cures drowsiness, good for her. Cold water bath cures bleeding disorder. Hot water bath excluding head enhances strength and destroys cough and bath. Taking head bath in hot water is injurious to cough, eye, and cold water is good for eyes. During aggravation of cough and bath, one can take bath with hot water as medicine. Taking bath in very cold water during cold season leads to aggravation of kapha and bath. In the same way, taking bath with very hot water during summer leads to aggravation of pitta and rakta. Another is wearing cloth. Wearing clean cloth enhances beauty, success, longevity, presence of mind, recognition in the society, and destroys poverty. Wearing garland, application of fragrant drugs like chandana, kesar, kasturi, etc., and wearing of garland produces virality, fragrance, longevity, beauty, nourishment, strength, presence of mind, and destroys poverty. Padcharana. Wearing of footwear is good for eye, skin, and destroys disease of foot. It enhances strength, courage, and virality. Dandadharana. Holding a stick helps to ward off fear of dog, reptiles, tiger, etc., cruel animals with horns. In condition of tiredness and old age, helps to walk. It enhances quality of sattva, enthusiasm, strength, courage, stability, and power. It gives support and destroys fear. Chhatradharana. Umbrella protects from rain, wind, dust, fumes, mist, and intense heat of sun. It improves complexion and good for eyes and enhance ojas. Abhyanga. Massaging the feet cleans the foot, cures disease of feet and tiredness. It is good for eyes, enhances virility, rakshana, and enhances pleasantness. So all these are somehow helpful in prevention of diseases. So there is a conclusion: with the advancement of time, lot of changes has taken place inevitably in the social and religious custom and behaviors, and also in the mode of lifestyle of people. The Dinacharya regimen, if followed properly, helps to attain physical, mental, and spiritual well-being of an individual. Thank you.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Manjusri for the paper presentation on the topic clinical case presentation of AKAALAPALITYA. Dr. Manjusri, are you there? Hello, Dr. Manjusri. Hello, Dr. Manjusri. Please unmute, doctor. Hello, Dr. Manjusri. Please unmute, doctor.
Yes, sir.
Okay, doctor. Please share the screen, doctor. Your screen is visible, doctor. Please chat.
Good evening, everybody. I am Dr. Manjusri, first year PG scholar, Department of Panchakarma, Karnataka Ayurvedic Medical College, Mangalore. Today, I am presenting a clinical case presentation of AKAALAPALITYA. Satura Pariksha, a patient aged about 35 years, Mrs. Pratibha Rao, who was a housemaker and was married and who came to the OPD with the chief complaint of graying of hair since a year. The associated complaint was rough hair and splitting ends. The history of present illness As per the patient, she was apparently normal. A year back, she noticed that her hair was rough and a few of her hair had become gray in the temporal region. Slowly, in a few months, majority of the hair all over the head had become gray with roughness associated with burning sensation of the scalp. The past history was nothing significant, and the personal history, appetite was good, bowel was regular, and sleep was good. And then coming to the general examination, the build was moderate. There was no pallor, icterus, sinuses, clubbing, lymphadenopathy or edema. The BP was 130/80 and pulse was 76 per minute. Coming to the Asthana Pariksha, the Nadi was Vata Pitta Pradhana, Mutra and Mala was Prakrata, Jivha was Upalepita, Shabda was Prakrata, whereas Sparsha was Ruksha, and Akriti was Madhyama. Next, coming to the Dashavida Pariksha, the Prakriti of the person was Vata Pitta Pradhana, Vikruti was Ati Lavana Sevana, Krodha and Shoka, Sara Samhanana was Madhyama, Pramana was 52 kgs, and Sattva was Madhyama. Satmya, she was Sarvarasa Satmya, Ahara Shakti, Jarana Shakti, Abhyavarana Shakti was Madhyama. Koshta was Mrudu, Vyayama Shakti and Vaya was Madhyama. Coming to the systemic examination, the respiratory system, cardiovascular system and gastrointestinal system, there was no abnormality detected. The examination of the hair, the scalp was healthy with no lesions or dandruff. Hair color was gray. Texture was rough and it had split ends. The GSS severity score, which is the index to determine the gray hairs, was moderate, that is 6. That is, first the scalp is divided into the frontal, vertex, temporal, and occipital regions, and 1 centimeter square of the area in each region is taken, and then the number of percent of gray hairs in 1 centimeter square is taken and counted. The score 1 is assigned to under 10% gray hair, score 2 is 10% to 30% gray hair, and score 3 more than 30% of gray hair. The GSS was calculated by taking a sum of the scores at the 5 representative sites. Maximum score would be 15. The objective scores was further graded as mild. If the score is between 0 to 5, it was graded as moderate if the score was between 6 to 10, and if it was severe, the score would be between 11 to 15. But this patient had a moderate score of 6. Next, coming to the Nidhana, Shoka Shrama Krodha Kritaha Shariroshma Keshan Sadosha Pachati Palita Samvatyataha. In Ashtanga Hrudaya, Uttara Tantra, 23rd chapter, we can find the Nidhana as Ati Lavana Sevana, Krodha, Shoka, and Shrama. The Rupa has been explained as Jalaprabha and Ruksha in cases of Vataja, and Shyava, Pitaba in cases of Pitta, and Shweta in the cases of Kapha. Sputita Kesha and Shirodaha would be the other symptoms which are associated with AKAALAPALITYA. The Samprapti, due to the Nidana like Krodha, Shoka, Shrama, the tejas of the body in association with the Vayu gets localized in the head, causes Dagdata and Keshapalita. The Vyadhi Vinishchaya was AKAALAPALITYA, and in 26th chapter, the treatment protocol which is mentioned is Nasyai Taile Shiro Vaktra Pralepa Upacharayet. That is, Lepana has been advised for AKAALAPALITYA. The treatment with Japa Kusumadi Lepa is one which is mentioned in Chakradatta. Lohamala Amalaka Kalkai Sa Java Kusumai Naraha Sada Snai Palitaniha na Pashati Ganga Snana Chiva Narakani. That is, one who takes Japa Kusumadi Lepa application onto the head daily and then takes bath will be deprived of white hair, just as a person who takes Ganga Snana will be relieved of his sins. Equal quantities of Japa Kusuma, Amalaki pulp and Loha Basma are taken, and they are made into a paste either in the Kalvayantra or in the mixer. This is applied on the hair 1/4 angula pramana, that is 0.5 centimeter. The patient is then told to wait for 45 minutes and then to take cold head water bath. This LEPA was applied daily in the morning for 7 days, followed by cold water bath. The results were assessed after 14 days, that is 7 days after the last LEPA. The Loha Guna is, it is Tikta Rasa, Shita Virya and Pitta Hara. Japa Kusma flowers or the hibiscus has Kashaya Madhura Rasa, Snigdha Guna, Shita Virya, Pitta, Kapashamaka, and it is also Keshya. Amalaki is Lavana Rahita Pancharasa, it is Rasayana and it is Tridoshahara. Coming to the results, the hair color before treatment was Shweta, whereas after treatment it was Shyava. The GSS severity score before treatment was 6, whereas after treatment it was 0. Shirodaha was present before treatment, whereas after treatment it was not present. The hair dyes are of two types, that is oxidative and non-oxidative. This type of a hair dye is a semi-permanent hair dye which penetrates a little into the cortex, and so the color will resist up to 6 washes. The hair is a dead skin cell which is with the melanin pigment in it. It contains the keratin protein. As it is dead cell, it has 3 layers: cuticle, cortex, cell membrane complex, and the medulla. The cuticle is the external part of the hair strand. The cortex is the principal component of the hair, which contains the proteins and keratins and also the melanin granules. This semi-permanent hair dye, when it is applied, it is absorbed through the cuticle because of the pH value, and then it resists the wash for six washes. The hair color will not be going. Coming to the conclusion, is one of the most common and burning universal problem faced by youngsters in recent times. Due to the fast-paced lifestyle, excessive workload, there has been an increase in stress levels, leading to the increase in the incidence of AKAALAPALITYA. No systemic treatment is effective, and the patient must resort to hair dyes. The use of hair coloring agents with harsh chemicals will cause hair damage, leading to hair fall. LEPA has been indicated in our classics for AKAALAPALITYA. We can find a number of LEPAs even in Sharangadhara Samhita, which are called as Krishnikarana LEPAs, which specifies the local provoked dosha as well as helps in regaining the natural color and texture of the hair. Thank you.
Thank you, Dr. Manjusri. And thank you, everyone. Special thanks to our panel coordinator, Dr. Aishwariya and Dr. Madhavan sir. We will continue in 5:10 p.m. Please wait, everyone.